Brian, once you've found your techniques to be helpful, you'd like to give the patient something to do at home. Millions of people have back pain. We're always looking for management techniques, self-management techniques. Yeah. Can you show us a few of the Mulligan concept home exercises and mobilization techniques for the lumbar spine?
What a coincidence. I had a belt in my hand. I can't believe it. And we've got a victim. Look, I've just been travelling around the States, and when I do a 2-day program with Kevin Wilk, I just say to the audience, we've got 200 people out there, has anyone got a chronic problem with their back? Every time you arch back, you've got a pain. And up go the hands. And I get them out, and this is what I show them to do. Bearing in mind, no pain with any of the procedure. So, you need a belt, and I'll put that over Mr. Ed's hair without disturbing it. He's like Mr. Trump, he's got a bird's nest. All right, we'll put that up there. We're not ready, we're not right yet. He's hopeless, this patient, but we'll fix it. The elbows, now turn around and face the camera.
Okay.
Right, you're going to put your hands up and under. Okay. Goody. The belt, your elbows are outside the belt. Okay. Okay. And you're going to, in a moment, take your hands up to your chest. Okay. And when you take them up, you're going to get a lift. Right. And the lift is cranially or cephalically. Just turn around for a minute. You've got a patient, and he goes back, and he gets to say 3-4 or 4-5. And just remember, you can never locate a belt on L5's spinous process. The ilium each side prevents you. But I go down as far as I can with Mr. Ed. Now, can you bring your hands up to your chest? Brilliant. Now, he's locating on a spine. Now, give it a lift. Yes. He's now got a translation, if you like, in a cephalic direction. When you do these procedures, just bend your knee slightly. Yeah, that's fine, that's enough. And what I would like you to do is just to go back and see if you can do so with no pain. Stop there, yep, and up again. Any pain with that?
No pain.
No. All right, now, he's going back, and I would get him to do 10 of these, then remove the belt and see if he's any better. Now, we've found that with chronic backs, where they've had problems for years, as they do each one, they seem to go a little bit further, but they don't go all the way. So, can I turn you round to face David? What I'm going to suggest he does now is to keep his hands where they are, keep your knees slightly bent, and I'm going to ask him to go forwards and pull with all your might. Now, the reason for doing this is to try and separate those facets, and then he comes up and goes back while he's still pulling. So we're just trying to separate them, and you'll find that they progressively go further and further and further. But it's just that they've been stuck, say, for 12 months, and you just can't lift them, and you get pain. Go forwards first to pull them apart, then come back.
So Brian, as you go through these motions, Ed is limiting his motion quite a bit, but he may be working through full lumbar range of motion.
Oh, yes. Yeah.
It's not so important that the patient bends all the way forward as if they were going to touch their toes. No. They're trying to get lumbar.
As long as he's stretching the lumbar spine.
Correct.
Thank you. Thank you. Yes. Again, he's proving to be very useful, David.
And as we had mentioned previously with the table, a patient freestanding in the middle of the room might be a bit apprehensive to go back into a lot of extension.
Lean against the table.
So we'd have him lean against the table and really isolate.
I didn't know to do that.
Motion.
You've taught me, and you were correct.
Great.
It localizes it, so that's absolutely wonderful. And you can choose different levels. And you may have done that spring test, and they say, look, it's painful. You do these, lie them back on their tummy. Ah, that's better.
And reevaluate.
Yeah.
How many times throughout the course of the day, how many repetitions would you recommend they do?
Well, Mackenzie says, if you need extensions and standing, he says every hour or so, do them. Just keep at that disc to get it better. Well, if you so desire, you can do them several times a day, every couple of hours. If you've got a belt, just do a few, just check it, just monitor it. Oh, a little bit of discomfort, let's clear it. Okay. And eventually, the spine gets used to where it should be. The memory comes back to some of those joints, and the patient feels heaps better.
A few may be as few as 10, as many as 30.
Yes, yep. Rarely is 30 needed. 10 normally does it for you.
Okay.
Yep, yep. But this trip, we've had people who can't go back, and they've gone all the way back, so I can see over the top of them.
Likewise,
using a belt.
this is a very successful home technique.
Very successful. It's revenue reducing. I'm sorry, it's revenue. You teach them to do this, but you know, the quicker you succeed with patients, the more patients you have.
Absolutely.
Those patients go out and said, look, I've had treatment from so-and-so, I got nowhere. I went and saw Dave, and he fixes me. I walk out feeling better straight away, and he's told me how to manage my own pain. Go and see him. And that's as it should be. Good.
Very good.
While I'm tidying up, would you like to show Mr. Ed how he can use his hands to self-snag?
Absolutely.
Oh, thank goodness.
The next technique or home exercise will be a snag that you can do, a self-snag that you can do with your fist. Just make a fist, Ed, okay? Just go ahead and turn around. So let's just go ahead and lift your shirt, Ed, so we can give the viewer a clear look.
I'll come and help.
Okay? The patient will make a fist, and they'll use the proximal phalanx. This is a central technique, and they'll use the proximal phalanx to make a purchase on the spinous process. Their other hand will provide the snag underneath, okay? And Ed will just lift up, lifting the superior segment, maintaining his traction, and have the patient then go ahead and extend and come back. Very good.
And he can go in deflection.
And he can do flexion as well, correct. Go ahead and bend your knees a little bit, Ed, and then just bend forward. Good.
I'm glad you mentioned bend the knees because it does relieve the neural tension and the hamstrings. It makes it.
But this is a good technique. If you don't have a belt, if you are on your own, if you don't have the tools available, the fist traction can be a very helpful technique.
Speaking of not having a belt, if you go to an airport, they sell those straps that you put around a case to secure them, and they're made of a webbing, and they're narrow, but you can buy those and loop two together if needed, and they're quite useful.
Very good.